state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. This is the position of World Health Organization. Hello and welcome to Healthy Living. I'm Aisha Salihu. On today's episode of the program, we're talking about the prevalence of hypertension, a medical condition better known as high blood pressure. Its causes, symptoms, risk factors, group of persons at risk, stages of hypertension, prevention and treatment, or better still, its management techniques. Let's take a look at this special report.
Hypertension or high blood pressure is a leading cause of morbidity and mortality in Africa, and Nigeria, the most populous country in the continent, hugely contributes to this burden, with a high level of prevalence due to its function as a major risk factor to cardiovascular diseases, which claims nearly 250,000 lives in Nigeria every year. A doctor will recommend various treatments depending on the blood pressure.
Basically, hypertension means high blood pressure in lay terms. So what happens is that the heart is a pump, and then it's connected to blood vessels, arteries, and veins. So the heart pumps blood out through the arteries to supply the rest of the body. So the force of the blood that flows from the heart through the blood vessels is known as the blood pressure. So when this pressure is above a certain limit, it's said to be high blood pressure and hypertension.
According to WHO, the medical condition hypertension has been prevalent and needs attention from all quarters. What do you think is the cause or perhaps the possible risk factors?
All right, thank you for that question. That's a very good one. I'd like to start by saying that hypertension is not a disease in itself, but it's a risk factor for a lot of complications, most especially cardiovascular disease, heart failure, and stroke, even renal disease. So it's something that's something that's really very important for us to pay attention. I'd like to say that 90% of high blood pressure is said to be essential. There are two basic types of high blood pressure: the primary or the essential, and the secondary. So in the primary one, you can't really point to any cause. Most of the time it's hereditary. Right, so maybe there's a family history and the father and the mother, so genetics play a major role in that. And the secondary has usually linked to certain medical conditions. It could be diseases of the kidney, diseases of the thyroid, it could be from hormonal imbalances, there's a whole gamut. So in assessing a patient with high blood pressure, you want to first of all categorize this patient into either a primary or a secondary type, because the secondary ones have been linked to, the prognosis is sort of better, because if you're able to identify the cause and treat, that takes care of the blood pressure. So coming to the risk factors, like I said, it may be genetic, right? So it just runs in the family. People have a predisposition or a likelihood or a tendency to develop this. Apart from that, there are a lot of other things that come into play, like lifestyle changes. Sedentary lifestyle, a lifestyle where you don't move around much. So drive to the office, sit in the office. When you're done, drive back home. So the level of physical activity is minimal in these people. That's one of the major risk factors for high blood pressure. And then the diet. So if you are predisposed to a diet that's high in salt, right, because salt draws in water. So when you have a lot of salt in the system, it draws water into the blood vessels and increases the pressure within the cardiovascular system. This has been linked to that. Then habits like smoking, excessive alcohol intake, stressful lifestyles, all these have been linked to high blood pressure. But then, like I said, not a cause, but a risk factor. It's the secondary ones that you can say, okay, these are the specific causes.
So what symptoms are there to look out for?
Beautiful. One of the major mantras of high blood pressure is the fact that it's defined as a silent killer. No symptoms whatsoever. Some of my patients tell me, oh, doctor, I'm on medication, but I'm tired of taking the drug. So sometimes I wait when I feel a headache or I feel funny, I know my BP is going up, and then I take my meds. that is a very dangerous thing to do because largely it's asymptomatic, no signs, no symptoms. You don't feel anything until the complication sets in. So generally, I would say that there are no symptoms to hypertension, and that's why it's termed the silent killer.
So then, which group of persons are at major risk of suffering from this condition?
Good question. So, like I said, if it's the primary, which forms 90% of high blood pressure, usually it's related to age. So the older a person is, the higher the risk of coming down with high blood pressure.
Every adult from the age of 40, as far as you're of black origin, is supposed to be on low dose antiplatelets for once the person is 40, or if the person has a family history of hypertension. As soon as somebody starts feeling some of the symptoms associated with hypertension, the person is advised to be placed on that.
Obese people, so usually there's a BMI where you measure the weight in relationship with the height and then put it into a formula, and then it gives you a BMI. So people that are in the obese category are usually predisposed to developing high blood pressure. Then heavy drinkers of alcohol, are predisposed to developing high blood pressure. Then people with other comorbidities like diabetes. So it's been found that there's something they call the risk factor clustering, where one disease condition predisposes or increases the tendency to develop another. So it's been found that people that have diabetes, 6 out of 10 of them have a tendency to develop high blood pressure. And then coming to the secondary causes, like I mentioned, so if somebody has a disease condition like a kidney disease or a thyroid disease or some metabolic disease, this too can increase the tendency to develop high blood pressure. High blood pressure or hypertension has different classifications. So there's the one that is pregnancy induced. So in some group of persons, their blood pressure is normal, they get into pregnancy, at a certain trimester of the pregnancy, the pressure begins to go up. So usually that's a pregnancy induced hypertension. Once the baby is out, you find out that the blood pressure comes normal. But as much as 50% of those women have a tendency to, continue with the elevated
You
blood
talked
pressure.
about the types. So what are the stages of hypertension?
All right. So now we have guidelines in classification of high blood pressure. Several bodies: European Society of Cardiology, American College of Cardiology, American Heart Association. So there are bodies that are in, how do I put it now, that are responsible for issuing out guidelines on management of high blood pressure, and classification is one of them. The most recent is that was brought out by the American College of Cardiology in 2017 that reduced the blood pressure, or the cutoff for high blood pressure to 130/80, saying that anybody that has 130/80 and above is already termed to be hypertensive, stage 1. Meanwhile, the JNC7 in 2003, which is a guideline that we have been using up until this one came out, pegged it at 140/90. However, in Africa, in Nigeria, we have not moved with the American College of Cardiology. We still maintain that of the JNC7, which pegs it at 140/90 and above.
So what treatment or management techniques would you prefer to any individual suffering from hypertension?
So that brings us to the stages. Like you have stage 1, you have stage 2. The 140/90 is the stage 1. And then when it goes higher than that, 160/110 is stage 2 and above. So depending on the stage at which you catch these patients, that tells us what management strategy to adopt.
A lot of people have shown response to these antihypertensives. And one thing, combining the medications with a good lifestyle helps. Diet modification, limiting sedentary lifestyle. Diet modification includes avoiding food that are high in low density cholesterols, excess sugar, because sugar can predispose to a lot of cardiovascular diseases that are implicated in elevated blood pressure.
There is a level called pre-hypertension. There's a level called pre-hypertension, 120 to 139 over 80 to 89. So this hasn't gotten to the cutoff of 140/90, but it's, just the figures before that. And it's found that if you catch people at this stage, you can actually arrest the progression to full-blown hypertension. So that's where the management strategies come in. Lifestyle changes. In fact, across all the stages of high blood pressure, in the management, lifestyle modification is key. And what do I mean by this? Exercise is one of them. It's recommended that you have at least 150 minutes of exercise per week. So we break that down to minimum of 30 minutes, 5 days a week. If you're able to do this, it's been found that this is able to push back or even control high blood pressure to some extent. So in persons that come in with pre-hypertension or maybe mild, we can advise, okay, so increase your level of physical activity, watch your diet, watch your salt intake, reduce that. There's particular quantities, that we recommend. And then more of fruits and vegetables. There's something called DASH diet, dietary approaches to stop hypertension, which basically talks of increasing intakes of nuts, legumes, vegetables, fruits, all this has been able to control blood pressure to an extent. But then if you're meeting someone in stage 2, you're meeting 160, 100 and above, you don't want to tell that person to just go and exercise. We need to start medication for such patients. And there are several groups of classes of medication that can be used in this patient. However, it's not a one-size-fits-all. There are recommendations depending on the patient in front of you. Every therapy is individualized for the patient in front of you. So there's a particular regimen that you may use for a younger person who has a very fast heart rate. There's a different regimen that you would prefer in someone that has diabetes or someone that has renal pathology. So it's not so easy. It's not as straightforward as saying, oh, my blood pressure is high, I just go and buy this and that and take. You need to go through proper evaluation in the hospital. There's a lot of trend I have noticed in our society. A lot of people boycott the hospitals. I know it's tough coming to the hospitals, the queues, the waiting time, but like they say, health is wealth. If you have to dedicate one day to do something properly to save your life, I think it's worth it. So it's important that anybody with a diagnosis of high blood pressure should be evaluated by a healthcare professional. Because like I said, they're secondary. So when you come in, there are tests that we run to categorize this person and say, okay, you're in this category or you're in this category. What is the state of the heart? Because high blood pressure can affect the brain, the heart, the kidneys. You want to look at the state of these organs and see how are they. You get baseline values so that by the time you start therapy, you can say, okay, so this is where we started from, this is where we are, this is the effect on the heart, on the kidneys, we're making progress, what dose, because the dose is not fixed. You can always adjust the dose based on the blood pressure response of the person. So it's not so simple to just say, oh, my blood pressure is high, I just start taking medication without passing through a healthcare provider. Like I said, it's a silent killer. I have had patients walk into my clinic, walk in, fine, normal, everything. What is it, doctor? I've had high blood pressure for some time. Okay, we check. 260, 140. I am really? And he's just sitting there, calm, no signs, no symptoms, nothing. That is the kind of patient that can walk out and just suddenly collapse. And we say it was an arrow from the village. So most of the times, these things take time to develop. But by the time you are having signs and symptoms, it's already too late. The complications have already set in. So it is life-threatening because it can lead to stroke. It can lead to a heart attack. It can lead to kidney failure. Do you understand? So these are not things that you want to toy around with. So yes, it is something that we need to pay attention to and be a bit aggressive in the management.
What would you recommend as the possible prevention measures to avoid its occurrence?
As a background to that, there was a recent study as recent as last year, 2020, by Adeloye et al. And it was found out that in Nigeria, 29% of people, only 29% of people that have hypertension are aware. So out of every 100 people that have high blood pressure, only 29 are aware. Now, out of this 29%, only 12% are on medication. So out of 100 of them, only 12 are on medication treatment. Then out of the 12% that are on drugs, we have just an abysmal 2.8% that are controlled. So that's that these figures are really alarming, because it was even found out that in 1995, we had about 4.3 million people with hypertension. But in 2020, it had gone from 4.3 to as much as 27.5%. That's a 540% increase within this period. And just 2.8% of these people are actually controlled. So you see that it's a major issue. And what are the factors that are responsible for this? Awareness. Awareness, awareness, awareness. We cannot overemphasize this. People are not aware. People hardly check their blood pressure. People hardly go to health facilities to get these things done. And because it's asymptomatic, it's silent. You just move around, and then until something happens. Oh, he was driving, and then all of a sudden, he just put his head on the steering, and he passed on. Oh, he was in the office. The next thing, oh, my chest, and then he falls down and dies. Or all of a sudden, he was sleeping. He noticed that he can't breathe. Later on, his feet started to swell. Heart failure. Do you understand? So it's something that we need to drive awareness. Let people get checked. Let people know about this condition. Let people know the possible complications. Let people know that it's preventable, it's treatable. So coming to prevention, what can I do to prevent this? Lifestyle. Lifestyle, lifestyle, lifestyle. Exercise is cheap. Exercise is cheap. Something as little as 30 minutes of brisk walk, minimum 30 minutes of brisk walk 5 times a week is unbelievable, the effects it can have. It can prevent high blood pressure, it can prevent diabetes, it can control the cholesterol levels, because these are the risk factors that come together to affect the heart or the cardiovascular system, leading to cardiovascular deaths. So exercise, exercise, exercise. Then diet. All classes of food are important, but it's the proportions that matter. There is a chart, sorry, I don't have one here, that divides the different classes of foods and the proportions that we should take. So if this is your plate, you divide it in 2. Half of that should be more of fruits and vegetables. Less than 50% of that can be carbohydrates. And then the other fraction can be protein, healthy protein. Red meat is rich in cholesterol. So for people that have that predisposition, we'd advise them to stay away from that. White meat is healthier. So fish, chicken without the skin, all those are preferable. In addition to a diet rich in nuts, healthy nuts, legumes, fruits, there are potassium-containing fruits. These ones, particularly like oranges, bananas, watermelon, they are really rich in potassium. And it's been found out that potassium levels are one of the things that are implicated in high blood pressure, especially the secondary one. So a diet rich in fruits and vegetables is very, very key to preventing. Then limiting alcohol intake. Red wine, they say, has been found to be cardioprotective, helps to prevent one from developing heart disease, even dementia, but not more than 1 glass a day. So people that binge on alcohol, they go on the weekend and they just go crazy. No, those ones are more predisposed, to developing high blood pressure. And then for women, you don't take more than two. There's a way we categorize it. For men, for women, not more than 14 units. For men, not more than 21 units a week. So there's a way we categorize alcohol consumption. So anything beyond this increases the risk. Right, then smoking, tobacco smoking, because what tobacco does, or smoking, is that it goes, in the long run, it thickens the blood vessels. So these are the vessels that carry blood to the entire body. So over time, it causes a hardening of these arteries and yes, of these blood vessels. And when they become stiff, they are unable to expand and recoil accordingly. This increases blood pressure. So tobacco smoking is a no-no. Even passive smoking, being in the same environment with a smoker, is equally as dangerous. And then a lot of other things have been coming in, things like environmental pollution, but those ones, we can talk about them some other time. But these are the major ones, in addition to the fact that as we get older, the incidence of high blood pressure increases, so you need to pay more attention. Generally, men have a higher incidence than women. So many factors have been put forward. One of them is the fact that the estrogen in women is sort of protective. But by the time they attain menopause and the estrogen levels drop, their levels become at par with that of the men. So the older we get, the risks of these things increase. So the lifestyle measures are so key in preventing the onset of this disease.
You talked about awareness. So whose responsibility is it to create awareness? Is it the individuals or the government? Who do you think should take charge of this?
So I would say it's a joint venture. Things like what you're doing now, highly commendable, because we are in the healthcare facilities. It's when the patients come to us that they get to know these things. But if we're able to create avenues where there's dissemination of this information, the way when HIV came in, all the jingles, billboards everywhere, turn on the radio, they're singing HIV/AIDS. You put on the TV, they're talking about HIV/AIDS. So these things help to increase awareness. People need to hear these messages. People need to be aware of this. And then we can talk about public enlightenment campaigns, use of billboards, radio jingles, and then generally increasing the awareness of people to things like this. And then it's not just awareness alone, because a lot of patients that come to the hospital can't even afford the medication. So if governments can beef up the healthcare insurance system, increase the coverage, expand the coverage. Right now, the coverage is so narrow. So the majority of the populace cannot access these insurance packages, and then they have to pay out of pocket. So even the investigations, they pay out of pocket, the medications, they pay out of pocket. Majority of people cannot afford this. So if government can come in to help to, what's that word, when you reduce the cost of subsidize, thank you very much. So government can help to subsidize the medication, the treatments, the investigations, the medication. It would go a long way in, curbing this this scourge.
Now, there are diuretics like thiazides that are indicated for management of hypertension. You have the calcium channel blockers. Commonly used is amlodipine, nifedipine, and then we also have the beta blockers like propranolol. You have the angiotensin converting enzyme inhibitors, and a related one, which is angiotensin receptor blockers. You don't use the angiotensin converting enzyme inhibitors together with the receptor blockers. They are used if somebody cannot tolerate the one. So because of the side effects that are associated, they can switch to that. So those are the basic basically used antihypertensives. And you start from, there's a progression.
Let's go on a quick break. The program continues in a moment. It's nice to have you glued on healthy living. Let's go to the streets to find out how many people are fully aware of the existence and prevalence of hypertension, how they have been able to manage and survive it in spite of how busy they get.
I started far back in 2018 and have been managing it without medicine, but I decided to be managing it with medicine in the last month. The medicine they gave me, I discovered that I'm having a little swelling on my my ankle there. So I saw something related to the drug, the medicine I'm using. So I read it, they said that women always have that problem. So I'm contemplating maybe by next month I'll meet the doctor to change the medicine for me.
In really managing my situation, I kept going, I kept having tests here and there. Before I knew it, it dropped. First, it dropped even below par.
My mom have it, but she has been managing it for like 20-something years now. And sometimes she go to check herself. Sometimes they will say it's low, sometimes they will say it's high. But she don't eat salt because they ask her not to be eating those things.
I advise the person to go to the nearest hospital to go and check his blood pressure and then seek for relevant information on how to reduce it.
It doesn't say that I should stop thinking. That is thinking that is causing high blood pressure.
Well, you've heard from people on the street. Being healthy should be part of your overall lifestyle. Living a healthy lifestyle can help prevent chronic diseases and long-term illnesses. Feeling good about yourself and taking care of your health are more important for your self-esteem and self-image. Maintain a healthy lifestyle by doing what is right for your body. Until I come your way again on another episode of the program, it's bye for now. I'm Aisha Salihu.